Hello, everyone. I'm Michiko Hayashi from Emoto Peace Project in Tokyo, Japan. Today, I am so happy to introduce you Dr. Carole Ann from the United States. She is the former president of American Holistic Nurses Association, and also she does a private holistic practices, and also she is the international speaker in educating all the holistic or nurses around the world as well. So Dr. Carole Ann, thank you so much for being here today.
Oh, it is absolutely my pleasure. It's always wonderful to talk about holistic nursing.
That's wonderful. I'm so happy that I can introduce what holistic nursing is here, because here in Japan, I don't really hear holistic nursing so much yet. Although we started to hear holistic medicine, so that's a good sign. And so now, Dr. Carole Ann, would you please tell us how you started or why you, because you are the former president of this American Holistic Nurses Association. So you must know from the beginning. And how did you start this?
Actually, the Holistic Nursing Association began in 1981 because our founder, Charlotte McGuire, was upset because nurses were overworked, they were underpaid, they weren't taking care of themselves, and she said there has got to be a better way. And so that's what she did. She put a tiny ad in a newspaper, and 40 nurses found it for the first meeting. Can you imagine that? I mean, it was just a tiny little ad that said, "I want to start a holistic nursing association. Come if you are interested." Wow. 40 people showed up, and they went around one by one, and they talked about how much they are tired and they're worn out. And they also talked about their dreams and what they thought nursing could be. And so that was how the organization started. I joined 2 years later and have just absolutely enjoyed every minute of watching it grow to now over 5,200 members.
Wow. That's in what is since 1981, 91. So it's been 40 years, 30
Yes.
years, 40
Yes.
years.
40, yes.
Wow, expanded. And now you're expanding. I mean, we are starting Holistic Nursing Association here in Japan too, as we interviewed you and Rumi. So this is really amazing. And what, for people who don't know what holistic nursing is, would you kind of please explain what it is?
Holistic nursing is looking at the whole person instead of looking at a patient, and a patient means somebody is sick. So they're only looking at what is sick, whether it's their heart or their liver or their stomach. But we're looking at the whole patient, which means we know that whatever, let's say it's a heart problem, that person has a heart, but it also has a liver and a spleen, and it has feelings, and he or she has emotions. So we are looking at the body, the mind, and at the spirit, and know that they are all surrounded and folded with a God, a creator, whatever, and going around the world, whatever you want to call that, higher power or whatever it is. So we want to look at everything because we know they're all linked up together.
Oh, sure. Because I remember we do have this section of Hado. Hado means vibration in Japanese. Hado consulting field, because Dr. Emoto started as an alternative, the doctor of alternative medicine. Yes. When we have problems, there's always the root cause of why that happened.
Yes.
When we don't really look at it, we can't really heal. I mean, maybe we can heal, treat it just for the moment, but you can't really heal that person completely from the root. So that's what you're trying to do holistically.
Yes, that very well said. Yes, you have to address everything. You've
Mhm.
got to look at the vibrations, you got to look at fears, you have to look at the family. I mean, it is so complex, but at the same time it's so simple because when we spend the time to find out, then the healing comes much easier.
Mhm.
Yeah.
I can see that. So, but you said at the beginning when 40 people came, 40 nurses came at the beginning in 1981, um, they said they were really worn out and they should be paid more and all that. How can holistic nursing help them, nurses, heal? What do you, I mean, they have to be healed, right?
Right. And that is one of the very strong points because we're very strong on self-care. And
Sure.
the nurse has to take care of themselves in order to be able to give care. You can try to give care, but everybody knows that if you have a headache and you go to work, you have a headache.
Right.
And it's very difficult to focus. It's very difficult to really be concerned with somebody else when you have a headache.
Right.
So we need to be able to take care of ourselves. And once we are really take care of ourselves, get enough sleep at night, stay warm, eat nutritious meals, really take care of ourselves, take time, even if it's just 5 minutes
Mhm.
for ourselves, then it's like our energy field expands, we have more energy, we feel better, and we can finish the day with more energy than when we started, even on a hectic day. Yeah.
Oh, so self-care is the first thing that we really
Yes.
have to think of.
Yes. Yes.
Yeah. To be able to help someone else, I need to be well. I mean,
Yes.
spiritually and physically, right?
People learn more about people learn more through our actions
Mhm.
than they do our words.
Mhm.
And here the Native Americans, the Indians, would say, walk your talk and talk your walk.
Wow.
And if you are not walking your talk, then and you do not speak. You
That's
have to
right.
take care of yourself first. Very, very simple. Yeah.
That's right. Yeah, you have to be doing what you're saying. So, right. So would you please tell me why, what kind, where in the United States and where you have all these holistic nurses in the United States, maybe around the world also, right?
Yes, we are in let's see, Canada, Spain, no, Canada, Italy, now in Japan and Australia.
Uh-huh.
And we are getting interest from other countries. So it really is becoming international. The
Hmm.
beautiful thing about holistic nursing is it's a specialty, just like pediatrics, maternity, medical, surgical. Only the difference is holistic nursing you can do in any of the specialties.
Hmm.
You can do it any place. You can do it in a nursing home. You can do it in a doctor's office. You can be a holistic nurse to a football team. I mean, it is in itself so versatile that it makes it just, it gives you extra advantage, I know, over other nurses.
Hmm. Um, so when you're saying that it's a holistic nursing, what kind of methods or modalities do you apply? See, because I mean, there are
Med-
so many ways.
well, and the answer is yes.
Mhm.
Because as a holistic nurse, you get to choose which modalities you want to use. Some
Mhm.
people want to use Reiki and they find that is where they want to go. Another person wants healing touch. Another person wants to do irisology, where they look at the iris and do readings. Another nurse wants to combine uh, their energy work with massage. I mean,
Mhm.
there's so many different ways, and all the alternative ways are acceptable. We have some people that love essential oils.
Mm.
Other people that are very much into herbs. We have people into organic gardening. So
Wow.
you can literally use any alternative modality you want, or you can put a couple together.
Well, that's wonderful. So all the patients can maybe, rather than choosing, nurses can probably tell what modalities they want to use for the specific patients. Is that how you feel?
What we do is when we do their interview and we take their history and all, we ask them if they use any alternative types of therapies
Oh, I see.
outside, and we tell them, hey, it's okay, I use them too, and it's okay where you are to tell me about them because we can help you use those better.
Right.
And even if they've never tried to do meditation or relaxation, we often just say, you're getting a little bit uncomfortable with your pain. Would you like to try a little bit of breathing to see if that will take the edge off of it before I give you your pain medication? Because the pain medication kind of knocks you out and you don't like how, it makes you feel kind of goofy and you don't like that.
Right.
And people say, yeah, I'll try that. So we do a meditation with them. And then they get excited and they'll say, oh my goodness, this works so well.
Wow.
What
See,
else?
it's so beautiful because I know that in the hospitals or clinics, most of the hospitals only give the patients the medicine for the symptoms. But I mean, when they take those medicines, then they may have side effect and then they give more medicines, especially with pain too. But when we don't have to take any medicine, but instead, if the breathing or meditation can help us release the pain, that's a most wonderful. I mean, we don't have to take any medicine.
And you know what? Our bodies love it because our bodies have an immune system. What we do need to do is do things that keep our immune system strong. Yeah. That's how we can support our body. And then our body is in a better place because it's in balance.
Sure. So what do you advise to all the people when they want to boost up their immune system?
You're going to laugh, but the first thing that I tell them, you have to get more sleep. Because while you are sleeping, that is the time that the immune system kind of takes a breath. It's still busy working all over the body, but it strengthens it because you're resting, and it's not, our immune system works 24 hours a day. So you're not getting out into the pollution when you're driving your car. You're not doing all that. You're in one place and hopefully it's fairly clean air there. So the immune system can reboot itself. Yeah.
So sleep is one of the most important things.
Absolutely. Absolutely. Without sleep, we are in trouble because when we have to stay awake, our body says, okay, I'll help you stay awake. So all the energy that goes to our brain now is going just to keep you awake. So you don't think as well. You don't make good decisions. You're a little bit short. You're tired. And what do? We reach for caffeine. We reach for sugar. Two things that, a little bit's okay. It's not saying you never have it, but it's reaching for it and depending upon it.
Right. Yeah.
Yeah.
And subconscious, I mean, without being aware, they just drink more coffee, they take more sugar. So, what is so good about sleeping is that I think, well, when I was sick, it's amazing how much you can sleep. Your body is trying to recover yourself. So all you need to do is drink water and keep sleeping. And then it's just amazing how many hours and hours and hours you can stay sleeping.
Yes. You know, when you get the flu, what do you want to do? You naturally want to lie down. You want to be still.
Mhm.
That gives that means the body doesn't have to put attention on walking, on thinking. It can put 100% of its time on fighting off whatever is going on and getting you back into balance.
Right.
I have two daughters, they're
Mhm.
grown, and
Mhm.
when they were growing up, one of my rules, if they were ill and off from school, when they felt better, they had to stay home another 24 hours. And
Oh.
they'd say, "Oh, mom, no, I got," and I said, "No, you're staying home one extra day," because I had seen too many times people coming back to work, they were feeling fine, and 2 or 3 hours later, they were totally washed out. They
Oh.
really weren't. You know, they got up in the morning feeling good. And that extra 24 hours
Mhm.
just was what the body needed. And I also, I was the head of a baccalaureate nursing program. And I said to my faculty, hey, when you're off ill, I want you to stay home an extra day before you come back.
That's wonderful. I
And
mean, how many people would
they
say
would
that to you?
say, and they would say, oh, this is so great. I never thought of that.
Mhm. Yeah. Extra day to completely recover
Yes.
and be well.
It is giving ourself, and this is real important, giving ourself permission to take care of ourself
Mhm.
because we're important. We are very important to ourselves, to our family. We are very important to the patient. So we want to be able to give not just good care, we want to give them great care
Mhm. Mhm.
so that they really feel loved and given to. And by the end of the day, we can walk out and still have and be energized and say, oh, this was a great day.
Oh, that's so beautiful. You just said that you want the patients to feel loved.
Yes.
How do you usually, I know that in the hospitals, clinics, most of the nurses, I mean, because they're taught to do this, so they do everything automatically without much of the emotions, and then a lot of times patients or even I would feel kind of uncomfortable, don't know, can I say this to her, or can I do this, or what do I do? I mean, they just do like a robot, I mean, I
Yes.
shouldn't say robot, but robots can also do it because they don't have the much of the emotion in there. So how would you
How
say?
you easy way to start before you walk in the room, stop at the door and just literally stop, take 2 or 3 nice easy breaths. When what that's doing is you're catching up to yourself because you've probably walked very fast to get to the room. And you can even do this in emergency. It's going to take maybe 15 seconds to do this. And even in an emergency, you really have 15 seconds.
Mhm.
You stop, you take a couple deep breaths, you put a smile on your face, and you walk in totally focused on the patient. It's like there's nobody else on the entire planet. I am here entirely for you. You give
Oh,
them eye contact, you smile, you call them by name, you walk up and you look at them and you say hi.
oh,
My
isn't
name's
that?
Carole Ann. I'm going to be your nurse for today. How you doing? Or what's going on? Or you had your light on. Do you hear my voice? It is a voice of caring. It's not, hi, I'm Carole Ann, you had your light on. What do you want?
Such a big difference. Yeah, yeah.
And see, the thing is, the patients, many of them don't really know about energy and all, but there's an energy on how you feel. And the heart energy is a very strong, loving energy. So when you step back and you're totally there, your heart energy is coming around and embracing them. They feel that.
Mhm. Mhm. Yeah.
And just that alone, the pain can start to go down.
Oh, isn't that wonderful?
Because it's like I'm not alone.
Mhm.
There is somebody here that cares. Their fear level starts going down.
Mm.
Now, sometimes you might have to work a little bit with them. You know, you got pain, okay. You know what? Not quite time for your pain medication, but come on, let's find where you feel the most comfortable. Let me rearrange you and put some pillows. And then I want you to do some breathing with me. Would you do that? You know, and when you're standing there smiling and helping them get comfortable, they're saying, oh, okay, I'll try.
Yeah,
Oh,
yeah.
that's all you
They
need
start
to do.
to open
Yes,
their heart to you. Yeah,
yes. And when they open, you're sending energy out.
you're
They
right.
open their heart and the loop
They-
comes back.
Yeah.
And then it starts to get stronger and stronger.
Mhm.
And patience repeatedly will, when you walk in the room later, or if they're there for several days and you have the same patient, they'll say, I always feel so much better when you walk in.
Oh, wow.
And I'll say, oh, I like you too. Let's see what's going on.
Mm.
Let's have a really good time while I'm together. What do I need to do to help you feel better?
Mhm.
What is it that you need?
So
And then,
it's really
yeah,
technical things, but also your really most important thing is for you to give your heart to her.
yeah,
I mean, to
yeah,
share that beautiful
yes.
heart and caring and all that
And you
with the
can have that beautiful heart and caring when you're catheterizing a patient, when you're giving an injection. I used to give painless injections. They couldn't figure out, how come you can give that and it doesn't hurt, and the other nurse, it hurts.
Mhm. Yeah, well, it's
I'll
because
say,
it
well,
comes from.
that's a little bit of holistic magic.
Mm-hmm. So, would you share how breathing can help people? I mean, maybe if breathing can help release pain, I mean, how it seems like it's one of the most important things that we can do that we have not really even been taught to do.
That's right. And yet it is the way our bodies were set up. Breathing is the most important thing. It's the first thing we do. We take that breath in, and it's the last thing we do when we exhale. It is with us, it's our constant companion,
Mhm.
and it is our friend. And just really, there are a lot of different techniques out.
Mhm.
I don't really go with techniques. I want you to breathe how you normally breathe. You breathe in and out through your mouth, fine. You breathe in and out through your nose, however you want to breathe, fine. All I want you to do is fall into the natural rhythm of your breath,
Mm.
because they don't have to think about that.
Right.
When I say, okay, I want you to breathe into the count of 10, hold it for 10, and then breathe out. Okay,
Yeah,
yeah,
it's
all
hard
of
to
a
get.
sudden they have to think. But if they fall into their natural rhythm,
Mm-hmm.
it's effortless and they relax.
That's
And
right.
so, and it's staying with them and say, just go in your natural rhythm. Just very nice and easy. Don't change anything. And just listen to my voice and just very nice. Take a breath in. When you're ready, let the breath out. Just find that beautiful rhythm that's all your own. See, you're starting to do it and relax just listening to me.
Yeah, yeah, yeah. It's really interesting because it your energy or our energies communicate or affect each other
Yes.
beyond time and space. I mean, you're in the United States, I'm in Tokyo, but I can still feel your comfortable energy,
Yeah.
loving energy, caring
Yes.
energy being here just by seeing you and your smile and talking to you, hearing your voice.
You know what? You can do it over the telephone.
Mhm.
You
Oh,
can do it just thinking. Have you ever had somebody's come into your mind, your mother or a friend, and you kind of, I call it, you get a nudge. It's like they need something, or they just, oh. And when I get those nudges, I just take a moment, do a couple of of the easy breaths and surround them with love
Oh.
and say, oh, thank you for coming.
Mhm.
Take some love. Yeah. The energy is so powerful. It is just right there.
Right.
And
Right.
the more we learn about it, the more easy, the more comfortable we become. Just the very fact of me taking my hand up and bringing my hand out like this,
Mhm.
it's going to change the whole world. That vibration goes out.
Right. Yeah. That's right.
Yeah.
Vibration. Everything is vibration. Vibration goes out. We are generating our energy vibration and
Yes.
just
Yes.
expanding it.
And when you think about that, that means, and even our thoughts have a vibration. Yes, there's no place we can do, there's nothing we can not do for that vibration. So if it's a positive vibration going out, it's going to uplift people and it's going to keep us moving forward. If it's a negative vibration going out,
Mhm.
negative vibration slows us down and we get very heavy and we get stuck.
Right. It's
Yeah.
like one day I will show you the remote experiment I did with cooked noodle, and 5 people from around the world, 2 from the United States, 1 from Mexico, 1 from Europe, 1 from Japan. Those 5 people sent their intention or thoughts.
Mhm.
1 ignored, 1 negative, 1 positive and loving thought. You can see in 3 weeks, you can see complete difference.
Yes.
Results are amazing. Our consciousness, our energy is so powerful.
My house plants. Oh my goodness.
I can see that.
My orchids bloom and they stay bloomed for 5, 6, 7 months.
Wow.
And as they start to, you know, begin to grow old and they drop off, at the same time, there is another shoot coming off. And if I don't see it right away within a month, there'll be another shoot coming off. I have one orchid that has the plant.
Mhm.
And then it grew leaves up here on the one stalk. So there's now another plant up here. So the plant down here has orchids going off. The plant up here has orchids coming off. I mean, it is like, oh my goodness. Yes.
Yeah. That's something that your energy and loving energy is really
And
creating.
I get up every morning and I walk and I look at them and I talk to them just a little
Mhm.
bit in the morning. The same way with my plants outside. You
Yeah,
know, when I
right behind you, that the plant you have is really vibrant too. It's, I can tell it's their energy too. So
it's a bamboo plant,
uh-huh.
and I have cut it back 4 times,
Oh really? Wow.
and it just keeps growing. It says, "Okay," I'll say, "Come on, it's time for a trimming. You know, let's take this one off. You'll feel better if we get this one off." And my daughters laugh. They'll say, "Mom, you talk to your plants." I said, "Yes," and they answer me. They answer by growing. I have a clematis plant that
Mhm.
is only supposed to bloom 1 time during the year.
Mhm.
It's already bloomed that time, a second time this summer, and I just this morning I brought it inside because it's getting cold,
Oh,
and it has buds on it again.
wow. Amazing. So just imagine, it happens to plants and flowers and everything. Of course, it happens to us
That's
people.
right. And the difference is nature doesn't have a mind, doesn't have thoughts that keep it back. It is just totally connected. And we
Mhm.
need nature. You know, we need the trees. They are the ones that give us the oxygen. We give them our
Exactly.
carbon dioxide. So
Mhm.
we need them. And without the plants, we're going to die.
Right.
You know,
So we
that's,
should be appreciating them, always.
yes.
taking care of them instead of polluting, you know? So,
And now here in America, I laugh because the big push is that they're getting very good at creating plastic plants that just look like real ones, so you don't have to water them.
oh, okay, yeah. What can I say? People are busy, so maybe some people
No,
a
you're
fake
missing,
one.
you're missing the whole point of a plant, because we nurture it and it nurtures us. This plastic,
Communication,
yeah, absolutely.
communication.
That's what
So,
it is.
well, Dr. Carole Ann, it's probably about time. Is there anything that you would like to say, share with the audience today before we wrap up?
Um, First of all, I'd like to thank you for the opportunity.
Well, thank you so much for sharing
It has
your
absolutely
wisdom and
been
knowledge and everything.
a delight. And I would just really encourage everyone, if you only do one thing, if you only do one thing and change, and that is to get in touch with your breath and use your breath. You will be so surprised of what it can do. I was just at the dentist, and the dentist said, he says, you haven't had a filling in a long time. Do you want some Novocaines? And I said, well, I don't think so. And he looked at me and he says, well, some of these are pretty deep. And I said, I've never had any before. He says, fine, we won't use it. And if you need some, he said, you just let me know. And I heard him under his breath say to his assistant, well, this is going to be so fast and easy. And it was. Was there a little feeling of pressure? But what I knew was, with my breath, that I was able to relax and go into a very deep, peaceful place. So what was happening in my mouth was very far away from me.
Oh, wow.
You
So
know,
it
and I,
doesn't matter under what kind of condition, where you are, you can always apply that.
your breath is so powerful. And I would always tell my nursing students, if you don't know what to do, focus on your breath.
Mm,
It'll clear your mind and you will know what to do, or you will know what to say.
beautiful, beautiful.
Yeah. So keep breathing and enjoy the power of your breath. Thank you so
Oh,
much.
that's wonderful. Thank you so much, Dr. Carole Ann. And I hope you can really come to Japan maybe next year and share your wisdom, experience, and knowledge with Japanese people here also.
I would relish doing that, and Rumi and I are talking about that, so we'll see what we can put together. Thank you
Okay.
so much again.
Well, thank you so much, Dr. Carole Ann, for coming. And everyone, thank you so much for watching us today. And until next time, I will see you, and I love you. Bye-bye.